Alright, today we're going to go over glucose regulation and hormone regulation for pharmacology. Start off with glucose reg. Alright, where is insulin released from? Beta cells of insulin of Langerhans and pancreas. Alright, what is the action of insulin? Promote use of glucose by body cells and store glucose as glycogen in muscles and liver. What is the therapeutic use of insulin? Reduce blood glucose levels. What drug interactions, if combined with insulins, would cause hypoglycemia? Aspirin, oral anticoagulants, alcohol, oral hypoglycemics, beta-cyclines, and tetracycline. Which drugs, if combined with aspirin, would cause hyperglycemia? Thiazides, glucocorticoids, oral contraceptives, thyroid drugs, and smoking. What is the biggest side effect of all insulins? Hypoglycemia. Alright, so hypoglycemia is too much insulin. What are the side effects of hypoglycemia? Headache, dizziness, confusion, slurred speech, nervousness, anxiety, agitation, tremors, lack of coordination, sweating, tachycardia, and seizures. All right, hyperglycemia is not getting enough insulin. What are the signs and symptoms of hyperglycemia? Extreme thirst, dry mucous membranes, poor skin turgor from dehydration, polyuria, fruity breath, fatigue, tachycardia, Kussmaul's respirations. What are some different ways to give insulin? Sub-Q, pen, pump, or inhaler. Do we give short and long-acting insulins together? No, they will stick together, so draw them up separately and inject them in different sites. What are some of the nursing interventions for insulin? Check vital signs and glucose levels. Report hypoglycemia and hyperglycemia. Teach compliance with diet, insulin, and exercise. Have client wear medical alert tag because it can cause seizures of low blood sugar. Teach patient how to check blood sugar. And teach how to administer insulin. So how do you store insulin at home? So if you're going to use it for more than a month, put it in the fridge. Less than a month, you can have it in room temperature. But if you have it in the fridge, take it out 30 minutes before injecting it and make sure it's not in any direct sunlight or high temperature. Alright, now we'll talk about rapid-acting insulin. Is rapid-acting insulin clear or cloudy? It is clear. What do rapid-acting insulins end in? Log. What is the onset of action for rapid-acting insulins? 5 to 15 minutes. So make sure they have food in their system when they take it. What is the peak time of rapid-acting insulin? 30 minutes to 1 hour. What is the duration of rapid-acting insulin? 2 to 4 hours. All right, insulin lispro or Humalog is a rapid-acting insulin. What is the drug class of Humalog? Insulin. What is Humalog used for? Hyperglycemia and diabetes. What is the common side and adverse effects of Humalog? Hypoglycemia. What are the major nursing considerations of Humalog? Use with sliding scale, kicks in 5 to 15 minutes, give with food. What assessment findings would place the patient at risk when using Humalog? Check blood sugar first, see how much PO intake they have had. All right, regular insulins. These are short-acting insulin. Are they clear or cloudy? They are clear. When we're looking at the bottle, how will we know that they are a regular or short-acting insulin? There is an R on the bottle. What do the regular short-acting insulins end in? Lin. What is the onset of action of regular insulin? 30 to 60 minutes. What is the peak time of regular insulin? 2 to 3 hours. What is the duration of regular insulin? 3 to 4 hours. When can you give regular insulin IV? Whenever there are emergencies. What's the difference between regular and rapid-acting insulin? Regular is cheap and easy to get, maybe over the counter, but rapid is better for glucose control, but it is very expensive. Insulin regular or Humulin R is our short-acting or regular insulin, okay? So, Humulin R is what type of drug class? Insulin. What do we use Humulin R for? Hyperglycemia or diabetes. What's the common side and adverse effects of Humulin R? Hypoglycemia. What are the major nursing considerations of Humulin R? "30 minutes before eating, cheaper, IV, and emergency." What assessment findings would place patient at high risk with Humulin R? Check the blood sugar because it may be low. Careful giving to someone with low PO intake and other meds that decrease blood sugar. You monitor them closely. All right, intermittent acting insulins, isophane. Is that clear or cloudy? It's going to be cloudy. When we're looking at the bottle, how will we know it's intermittent acting insulin? There's an N on the bottle. What is the onset of action of intermittent acting insulin? 2 to 4 hours. What is the peak time of intermittent acting insulin? 4 to 12 hours. What is the duration of intermittent acting insulin? 18 to 24 hours. All right, long-acting insulin or Glargine, is that clear or cloudy? It's clear. What is the onset of action of long-acting insulin? 1 hour. What is the duration of long-acting insulin? What is the most important thing that you must do when taking long-acting insulins? Take it at the same time every day. And what type of insulin does this replace? The basal. All right, insulin Glargine or Lantus is our long-acting insulin. All right, what drug class is Lantus? Insulin. What do we use Lantus for? Diabetes or hyperglycemia. What are the common side and adverse effects of Lantus? Hypoglycemia. What are the major nursing considerations of Lantus? No coverage for carbs, used for basal insulin, no peak times, take every day, at same time, take even without food. What assessment findings would place the patient at high risk when taking Lantus? Gotta take it with the rapid-acting insulin. Check the blood sugar because it could be low. This is expensive, and you can't take NPH instead if cost is a problem. I would just go ahead and read this. But what must you take all combination insulins with? Food, because rapid are taken with food. What is the mechanism of action of sulfonylureas? Sulfonylureas, an oral antibiotic drug. Stimulate pancreatic cells to secrete more insulin. What is the drug class of these are sulfonylureas? It's a Glimepiride or Glipizide. Oral insulin. What is Glimepiride or Glipizide used for? Type 2 diabetes. What are the common side of adverse effects of Glimepiride or Glipizide? Maybe hypoglycemia. What are the major nursing considerations of Glimepiride or Glipizide? Check the blood sugar. What assessment findings would place the patient at high risk of being on Glimepiride or Glipizide? Sulfur allergy, low blood sugar, drinks alcohol. What is the mechanism of action of Biguanides? It's an oral antidiabetic drug as well. Increase insulin receptor sensitivity as well as peripheral glucose uptake at the cellular level. All right, Metformin is that Biguanide. That's the drug class. What is Metformin used for? Type 2 diabetes. What are the common side and adverse effects of Metformin? Diarrhea, metallic taste, hypoglycemia. What are the major nursing considerations of Metformin? Check the blood sugar. What assessment findings would place patient at high risk of taking Metformin? Hypoglycemia, no IV contrast dye 48 hours before or after taking this because you may develop renal damage. All right, what releases glucagon? Alpha cells of the islets of Langerhans. What is the mechanism of action of glucagon? Increases blood sugar by stimulating glycogenesis. All right, what is glucagon used for? Insulin-induced hypoglycemia used when they are unconscious. What are the major nursing considerations of glucagon? IM route is most common, but you can also give it sub-Q and IV. Check blood sugar. Eat food after it kicks in. And solution must be clear. What assessment findings would place patient at high risk of taking glucagon? Low blood sugar and the nausea, vomiting, and hyperglycemia can cause hypokalemia taking it. All right, 50% dextrose, D50Ws, and IV push. Dextrose, when do we use D50W? Hypoglycemia when NPO or unresponsive. What are the common side and adverse effects of D50W? Potential LOC changes. What are the major nursing considerations of D50W? You always want to check the blood sugar 10 to 15 minutes after administering. What are assessment findings that place patient at risk when taking D50W? Assess IV site because extravasation could cause severe damage. All right, now let's jump into hormonal reg. Alrighty. All right, what does the thyroid do? Regulates metabolism, heart function, and growth and development. What secretes TSH? Pituitary gland. What secretes T3 and T4? The thyroid that's stimulated by TSH. Alright, what happens to TSH and T3 and T4 in hypothyroidism? TSH increases, T3 and T4 decreases. What causes hypothyroidism? Dysfunction or surgical removal of the thyroid glands. What are the sign and adverse effects seen with hypothyroidism? Decreased metabolism and vital signs, client complaints of fatigue. What happens to TSH and T3 and T4 in hyperthyroidism? TSH decreases, but T3 and T4 increase. What causes hyperthyroidism? Increased secretion of thyroid hormone may have tumors. What are the signs and symptoms of hyperthyroidism? Increased metabolism and vital signs. Client complains of restlessness and anxiety. Motherfucker. What does levothyroxine or synthroid increase? Levels of T3 and T4. What is the action of levothyroxine or synthroid? Increases metabolism. What does levothyroxine or synthroid interact with? Increases effects of warfarin, decreases effects of digoxin. What is levothyroxine or synthroid contraindicated in? MI, severe renal disease, hyperthyroidism. What are the side and adverse effects of hyperthyroidism? Nervousness, insomnia, weight loss, tremors, headache, nausea, vomiting, diarrhea, cramps, tachycardia, palpitations, hypertension, dysrhythmias, angina, thyroid crisis. What are the nursing interventions for levothyroxine or synthroid? Monitor vital signs and weight. Take 1 to 2 weeks for good effects. Administer thyroid med first thing in the morning before food. Check labels before using over-the-counter meds. Assess for/report symptoms of hyperthyroidism and encourage medical alert tag. All right, what do the adrenal glands secrete? Glucocorticoids and mineralocorticoids. What do glucocorticoids do? Increase glucose availability, break down protein, maintain vitals, and affect mood and stress. What are some of the... How do we achieve the physiologic effects of glucocorticoids? Give normal secretion in small amounts. How do we achieve pharmacologic effects of glucocorticoids? Large doses from meds. What do mineralocorticoids do? Sodium and water homeostasis through RAS system affects the CV system. All right, name some glucocorticoids for adrenal insufficiency. Hydrocortisone and fludrocortisone. What is hydrocortisone? Synthetic cortisol. Tell me about hydrocortisone. Few adverse effects at normal doses, but if you have adverse effects, your dose may be too high, but you may need extra doses at times of stress and illness. What is fludrocortisone? Mineralocorticoid replacement and adrenal insufficiency. Tell me about fludrocortisone. Hypertension and edema indicate that dose is too high. Monitor vitals, weight, and F&E. What are the side and adverse effects of the glucocorticoids? Increased appetite, sweating, headache, flushing, mood changes, altered sleep patterns, increased heart rate, increased blood pressure, hyperglycemia, abnormal fat deposits, muscle wasting, edema, glaucoma, peptic ulcers. So what are some nursing interventions and patient teaching we can do for glucocorticoids? Do not skip doses or stop taking them suddenly. Take extra doses if you have a major illness or surgery. Take daily doses in the morning with food. And monitor blood sugar and blood pressure.